we will get started. Hello everyone who have joined us. Welcome to the meeting of the Board of Animal Care and Control. I'm Patrick Nolan, the chairman of the board, and we are looking forward to today's meeting, in part because we'll be voting on and approving the budget for fiscal year 15, so it's a very important meeting for us. And I think everyone on the board knows everyone on the board, but we have Nancy Barthold joining us today, a deputy commissioner from the Parks Department, sitting in for Mike Dockett, who is attending a funeral this morning. So welcome, Nancy. We're glad to have you here, and we had a nice conversation. We know that you're, among other things, a very passionate cat person, so it's great to have you here. It's great to have Parks on our board. The first official item of business, we need to approve the meeting minutes from the last meeting. So everyone, you have those minutes in front of you. A motion to approve. A second. Okay, let's vote to approve. All in favor? Aye. Okay. The minutes are approved, and we've just come out of a very productive executive session where we've gone through the budget for fiscal year 15 in detail, and we need to approve that as well. All in favor? Motion to approve, sorry. Yes, motion to approve. And a second motion, yes. All in favor to approve? Approved. So, and the budget will be posted on our website as well, just as a note to the public. And now we'll turn it over to Teresa for our executive director's report.
Good morning. Thanks to the public for coming. Thanks to ACC staff who are here, volunteers and who donates, volunteers, fosters, anyone who can help ACC. We're always happy to see you. So today's report is going to cover where we can, the end of our fiscal year, which was July 1 to June 30th. We don't have all the data because we collect the data through the end of June, so the next board meeting will have a full fiscal year of data to look at. So a lot of this is from January, and where we left off at our last board meeting which was a little less than 3 months ago. So just looking at the outcomes from January through May. This is the total picture of animals that have left our shelter. But if you look at the upper left, you can see what the intake was. So including owner-requested euthanasia, we had over 11,000 animals come in. And including owner-requested euthanasia, we had 11,000 leave ACC. And then the categories are all separated on the side. You can see New Hope. The outcomes is a little bit over half, and I'll get to New Hope and public adoptions in the next slides. So for the last 5 months, you can see our intake has gone up significantly because of owner surrenders. And we've been having lots of conversations about what's driving this and some of the thoughts behind it. Certainly our receiving centers are open for extended hours in the past year. They're all 7 days a week, 12 hours a day. We're also thinking that owners are coming to ACC to surrender instead of tying them up, which is something that we've seen in the past as well. We're going to, I think, see a rise in owner surrenders in the coming years as we try to be an organization that shows our compassion to people who are having issues with their pets in a more private and personal way. And we're going to be creating an admissions department where we would have that kind of counseling with owner surrenders. So this trend may continue. I raise it because it certainly makes ACC's job much more difficult because we have, as a result, so many more animals to find homes for, which which is a challenge, but that's what the goal is for all of us. If we go just back to live intake for a second, the owner surrender just in the last 5 months has been over 500, an increase of over 500. So we're seeing about another 100 animals being surrendered each month, and that's really going to drive the intakes up. But like I said, in the next board meeting, we'll see what the fiscal year was through the end of June. Euthanasia is pretty flat, considering the increase in intakes from 2013. The percentage of euthanasia is the same basically. The numbers looks like a little bit more, and based on the number of intakes, that's why. Placements. So again, for the last 5 months, a little flat. New Hope has done a little bit better. Public Adoptions has done a little bit better. I think that just for these last 5 months, the difference in public adoptions is about 48. I think when we look at the entire fiscal year in a couple of months and all the data is in, we probably would be close to 1,000 additional adoptions than the previous year, which is promising, but it's not good enough. We are striving to get every animal home through New Hope, great partnership with New Hope. We have a very vibrant team of individuals who work at ACC with the partners, so we're committed to making New Hope work. We've added, since the beginning of the year, we've added about 11 more partners.
So do you attribute the lack of adoptions to the weather or something else?
We think that the weather really had an impact. At the last board meeting, I had shown results for January and February, and they were actually down. Individuals don't want to leave their home. New Hope, what's so great about New Hope is that the passion to rescue and save animals is always there, and they have a transport vehicle through the Bears and Lions that can help them pick up the animals. So they may not have to come into the shelter, whereas individuals do. So I think that was a big factor.
So that hard weather decline we made up for.
Yes.
Slight increase.
So the good news is we did make up for the decline that I showed in April. It is a concern. I don't think that, we're looking, obviously, we want ACC to be the best and the most adoptions, but we're looking at benchmarking with other shelters, what's the national trend, what's going on in the city, how many more adoptions are other groups doing. There is some concern that it might be flat, but I think there's a lot that we can still do to make it better and to get more. Just the idea of getting an animal from a shelter. If you want a pet, come to a shelter, and that, as I get into the slides, you see, it's really about communicating the benefits of a shelter pet and ACC and everything that we're doing for the city, and how adopting from ACC would be a very good experience.
I think so many of the initiatives we should talk about that we're doing is going to help not only find new potential adoption moments with our truck, with all the social media, with the advertising, the constant promotions we're doing around our adoption program. I don't think we should be too worried that we've saturated an adoption population, potential adoption population. I think we have many more to find in their findings, and we're finding them.
That is our goal, absolutely. Okay, so in order to move animals out of the shelters, we really have to communicate who ACC is. We are working with a consultant who has done some focus groups and individual interviews with respect to adoptions, and that was to figure out what's going on in the world of adoptions. However, we realized something even bigger from that focus group, and that's ACC has a huge brand recognition challenge, and we need to build awareness. And just one comment was someone who had adopted from ACC couldn't recall that it was ACC where they adopted their pet. But on the plus side, they did recall, and the people who were in these focus groups who had adopted from ACC in the recent past recalled a very good experience, which tells us that the changes that we made to the program a year ago are working. And the effort of one-on-one counseling and understanding who wants a pet and the type of pet they want, that's all working, and the layout's working. But we have to, before people even think about adopting, they should think about ACC, and then drive traffic because people know who we are. So in order to place more animals, we have to build a better awareness, and we have to let the public know about our unique role. And I'll say it at every meeting, we are the only organization in the city that's taking in 30,000 animals. We are the only organization that turns nothing away. We are not selective. That's why our intake numbers are going up. We don't have the luxury of saying, we're done at 2,000 and we'll get these adopted and then we'll get a whole bunch more from the south. We don't do that. We get animals every single day. Like I just mentioned, just surrenders alone, we're seeing 100 a month. So we want the city, we want the community to know who we are, and engaging with the public, including city council, the mayor's office, politicians, wherever we can testify on animal-related issues, we will. We're going to get ACC's name out there as often as we can. I spent a lot of time in the past several months testifying before city council on a bunch of pet-related issues. We have meetings set up with city council members. We're pursuing the deputy mayor's office. So there's a lot of conversation that will happen and that will continue to happen. And of course, we're pursuing private resources. And when I get to development, you'll see it's really a goal of ours to gather up a community that can support ACC and that is proud of the work that we're doing and also committed to making it better. It's a lot of animals to place and we want to find homes for all of them. So to do that, we're building more relationships. So when we do some media or partnerships because people want to use our animals, we're really trying to find what's the best use of our time and our animals. And so it's not just because someone wants cute kittens in their photo shoot, it's because they're committed to animal welfare also, and that there's a message behind what they're doing, that it's an adoption message. And it may not be just ACC, it's about adopt an animal from a shelter, and then we'll get a credit that these kittens were from Animal Care Control of New York City. So we're really trying to, when we partner with people who want to use our animals in photos, try to build on that relationship. We're also committed to social media. We cannot communicate who we are without a very strong social media presence. And in the past year, you can see that that effort has improved. It's really gone up substantially in the last few months. We're up to 10,000 likes, which is up 79% for the year, which it would be great to see that at 100,000 likes, and maybe we can do that within a year with a lot of community support. We're also just day-to-day engagement on Facebook. We had participated in a program called Just One Day. We did a lot of outreach. We had 57,000 people who we reached that day. Also just using social media to better showcase animals available for adoption. And so we're going to work toward making the conversation on social media about ACC's animals, that who's available, when they get adopted, posted so people see that there's a constant movement of animals throughout ACC. And we get lots and lots of happy tales. People write in and tell us about their great adoption stories, and instead of waiting for a monthly newsletter or something on our website, we will share as many as possible and just get the message out there. Fundraising for the past year, we did a little bit better than the year before. We saw, these are our major sources of where the money came in. We did very well this year with respect to direct mail and online donations. We implemented a new software program, which I think really helped. Getting just more savvy at social media helped. Event revenue was much, much better than the year before. We had a couple of different types of events that we hadn't had in the years prior, which generated some significant additional income than last year. And the goal for development for next year is it has to be better, because while we're grateful for the money that the city gives us, we need more money. We need money to do what we're doing. We have a lot of animals to take care of. That requires a lot of staff. It requires a lot of services. It requires a lot of toys, blankets, bedding, food. I mean, it's endless, and it's every day. And every day the population continues to grow. So our goal is to be very aggressive in fundraising and building support among the community. And again, it ties into the communications. We have to be better at communicating who we are. And so, in order to do that, we're stepping out of our status quo and participating in things that other animal shelters have been participating in. There's, everyone knows about the no-kill movement. This Just One Day program is a national program where shelters across the country take a pledge to suspend euthanasia for just one day. And the goal is to promote shelters, to promote adoptions, to promote community outreach about what shelters do, and obviously to suspend euthanasia. So we participated. I think that we garnered a lot of goodwill from communities that look at us in a very poor light, that we're only here to euthanize animals, which is absolutely incorrect. And we're thinking like everybody else is. We want to save animals as much as everybody else does, but we have 30,000 of them, and other people don't. And so that's a real challenge. So by participating in Just One Day, we adopted 29 animals, which is a fantastic increase over a typical Wednesday of a regular adoption. And also just by having the mobile adoption vehicle at Union Square, we were talking about who we are, so there's a lot of great PR associated with it. And so we can't rest on that. That's not good enough, because on that same day, we received 95 animals. And it's a really hard task to get ahead of the intakes. And we have to think strategically about how are we going to balance all the animals that are coming in and all the animals that we want to get out. And so while we were thrilled with the results for Just One Day, we're also challenged and saddened by how many keep coming in. So what can we do to address these issues? Just to give you a snapshot again about the inflow, here's the issue we're addressing, the inflow. On any given day, this is what our population looks like. So we picked a random Monday in June, 561 animals are the ACC. It breaks down into cats, kittens, and almost 200 dogs. We compared it to a random Monday in March, which is where we ended our report last board meeting. We had data through March, so that's why we picked March. We had 418 animals, so you can see we're 112 more cats and 31 more dogs, and that's just in a random Monday in a month. And that's a huge challenge. So the things that we've put in place, the initiatives that we've put in place, are not only going to address the inflow, but also what can we do to improve the outcomes of all these animals that are coming in. In operations, I talked a lot over the past year about disease reduction and how we're going to improve health, which means better outcomes, so more animals get adopted or placed. Reducing transmission of disease. Just from the last month's reporting, we have installed even more personal protective equipment stations. We've added the booties for your shoes. We've added pants for our staff that are too tall. The gowns don't go down all the way, so now they have pants. And we're really limiting access to isolation areas by the public, by the staff. We have to figure out a way to try and prevent disease from moving throughout the shelter. And it's hard to monitor with the kind of traffic that we have, but this is our commitment. We're doing more training, sort of cross-training the animal care officers so that they get information from medical. Dr. Levin's going to speak about that. They've been working with the behavior department just so that an animal care worker who is with these animals on a daily basis, either in isolation or in any of the other wards, have a fuller picture of what's going on with the animal. It's not just about cleaning and feeding, it's a full picture of what's happening. And we're trying to measure it. So we're going to measure how many cats are diagnosed with upper respiratory infection and how many dogs are diagnosed with kennel cough. And we really have just started this program, and so we're looking just at a little bit of data and a little bit of change. But what we saw in Brooklyn is that kennel cough is actually down by about a third, which is remarkable compared to last year in 2013. Really no change for Cats or and Manhattan, everything's up. And so when we look at that data, it's a huge concern. That's not what success looks like. But what we saw, we looked at Brooklyn, and count cough is down by a third. What's going on there? And what we saw is that Manhattan has had a lot of turnover lately, and staff has been a challenge. Brooklyn can fully implement this program because they have the staff that they need. And we're committed to continuing to hire. There's a natural attrition rate in animal welfare, but until you have the staff there and committed and learning the policies and following the policies, you're not going to see any change. And so this is how we're going to measure what's happening with disease.
Why do you link staff turnover to disease rate?
Because you have to be trained in the protocols, and you have to know how do you clean, what's the right ratio of water to cleaning product. There's a lot to learn. You can't just get hired, put on a uniform and go. Because it just sounds like, well, we take care of animals, but we don't want you walking around from an isolation ward into the medical ward where animals are recovering from surgery. We're just a regular, there's a lot of training that's involved. And not only training to be an employee at ACC, but training to work in your particular department. Clearly, to improve outcomes, we have to focus on adoptions to the public. So since we revamped the program a year ago, we've had 26 promotions. We are always promoting anything we can, if it's the first day of school, if it's the first day of summer, if it's Whiskers Wednesday, whatever we can that's clever, just one day, we're going to promote it. And it's not about making money. We've reduced our fees substantially for these promotions. You can get a cat for $5. You're not in it for the money, you're in it to find homes for all of these animals. We also added the mobile adoption center, which I've talked about numerous times. Since we've added it in February, the first kickoff was February 9th, we've had 122 adoptions off of the mobile adoption center. Other benefits of it obviously are just the PR and the outreach that it garners. It also gives us an opportunity to promote ourselves to people who don't know us, who just walk by and say, hey, are you the ASPCA? And so we say, no, we're not, and here's would you like to be on our mailing list? And people have come by and just signed up to be volunteers. So it's a really good opportunity to promote ACNC. And we're trying to get that vehicle everywhere. And again, I know Bronx and Queens doesn't have a full service shelter, and wouldn't it be great to have it there all the time? But the truth is that where our shelters are located, they're not representative of the entire New York City area. So we have to get that vehicle to different locations in Brooklyn and in Manhattan as well. This Saturday there's an event at Barber Hardware in Tribeca. We're going to do something in Petco next Friday at Union Square. In July we have several things for the vehicle in the Bronx, in Brooklyn, and in the theater district. Also, yesterday we were in Staten Island. Last weekend we were in Queens. And prior to that, on Wednesday for just one day, we were at Union Square.
Do you tweet the locations?
We do. That's part of our social media plan. And I mentioned this earlier, so the results, you can see from January to May, it's only about 48 additional adoptions, and we're proud of every single one of them. I think we're more proud about the quality of experience that individuals are having when they come to adopt. I think by the end of our fiscal year, we'll definitely be in the 900s. I would love to see it as 1,000, but we'll see what the last month of data shows us. We have several promotions coming up just in the month of May and June. If you think about it, June is we're only 2 weeks into June, and May was 4 weeks. So in 6 weeks, we've had 6 promotions. So we haven't stopped promoting. And I know sometimes people say, oh, you don't advertise enough, I don't see your advertisements. And if you have some ideas of where you'd like to see an ad for ACNC, tell us. I'd love to see a billboard in Times Square too, but that's just not going to happen. So we try with the funding that we have and with people's resources and talent and commitment to finding us free space or donating the space, that's how we advertise. And of course, the power of social media is that it doesn't cost a whole lot to get the word out. So that's the direction we're going in. How else can we improve outcomes? Certainly behavior enrichment. The better our animals can be in terms of less stressed, better behaved, less illness, it all ties into behavior enrichment. So I've been talking for the past year about having built this enrichment program and department to add mental and physical stimulation for dogs and cats. One of the most recent things that we've done is to reconfigure the backyard in Manhattan to complement what we're doing with respect to isolation inside the shelter, so that animals that are in isolation can get outside and can get some exercise and some enrichment with behavior enrichment staff. And so we want to also make sure that there's no cross-contamination when we take them out. So we were looking at how do we configure the backyard to prevent that. So that's an improvement. And how are we measuring is behavior, is it working? Are the programs that we're doing working? And it's hard to say we've had 10 more adoptions because these animals were well behaved. That's a hard thing to measure, but what we are measuring is how many animals are receiving enrichment. We have a supervisor who follows that up and makes sure, who has been enriched, who isn't, do we need more staff, can we get more volunteers to help us? We also are seeing that more animals are maintaining their adoption-appropriate behavior, and as a result, they're staying at the shelter for a longer period of time. The question that I get very often is, how long do you keep them until you euthanize them? And that's just something that is such a myth, and something that all of us need to turn the conversation around and say, it's not about time. It's about somebody out there who wants to adopt an animal, who wants to step in and take a shelter animal. And so if this animal is healthy, and if a dog or cat has good behavior, it's going to enhance their chances for adoption or placement. So obviously good behavior is really key. And then we're getting a lot of positive feedback regarding, we're doing more information on our behavior summaries. We do a safer assessment, which is an ASPCA certification program, but we're doing much more than just safer, providing more information for just based on what our behavior team is seeing. Foster care is also another excellent way for us to make our animals ready for adoption. We all know that the shelters are a stressful environment. It's a great place for an animal to be outside of the shelter where they can heal from an illness or injury or maybe surgery. We have a great need for foster care right now for kittens in particular because they're so tiny and they're not available for adoption when they're that small. In the past 5 months, the foster coordinator has done an unbelievable job. She's had 10 foster orientations, 110 people have attended. We're going to have these orientations where you could leave with your foster kid. That is the best outcome. Come in, train you, talk to us, ask your questions, and if you feel you're ready, we shake your hand and we'll give you what you need in addition to the kitten. We're also setting up a more set schedule for fosters to have some medical follow-up so that they feel that they're supported. And how do we measure what foster care is doing for us? Well, first we measure is the program growing and how many animals are we getting more animals into foster? And so we've added 52 new active fosters. 14 of them actually adopted their first foster animal, and so hopefully after the whole the experience of being an adopter wears off, they'll come back into the fray and continue to foster for us, but that's also a very good outcome. We have over 300 total active fosters. We're really pushing the program. It really helps us. In May, there were 160 animals in foster. In June, and we're not done with this month, we have 96 in foster. And a majority of the animals in foster are adopted directly to permanent homes, which is a great outcome. Some of them show behavior challenges and they'll get placed with new hope. But the more animals that are getting that one-on-one care in a less stressful environment, the better prepared they're going to be placed in adoptions.
What do you think is our average monthly
Do we need each month?
Double?
I don't, yeah, double. I don't think we'd ever have a short, we can have a shortage.
Yeah.
Yeah, right, especially now, but,
We always see our posting on Facebook. That is how we're getting improvements, where we finding great things, where's the success with finding new fosters, how are we?
Well, we do have, we have a lot of people in, you actually got the letter, but we did have a couple months where very low turnout, so, the 110 people were really,
They were high community.
and now we can start trying to customize class orientation, so.
I'm thinking of a friend of mine in San Francisco, she's a banker, intense work schedule, she fosters puppies, and sort of does these very discreet fostering moments, because she knows her work schedule, and knows like, I'm good for 2 weeks, but I'm then away for a month. So are we targeting particular
Oh, yeah, we
professional communities?
Yeah, that's what we want to do, is see if people will post us in their organizations, around that time, or after work, kind of thing, or we
Great.
bring the organization. And also, she's been contacting a lot of our, co-op and apartment buildings, and we can see if they'll let us come in, and we do the rest of it. She has a couple of those already.
Great.
so you kind of jumped ahead to my presentation in 3 months, because that's what we have planned for fiscal 15, so
Great.
you could ask that question again. And community outreach, education of the public, really, our field services are a symbol of that. They are really out there, not just picking up dogs and cats. They are the first responders when there's an animal that's injured, sick, abandoned, people in an apartment call up and we just had, it was a hawk, I think, that was like stuck in an air shaft. Our field shows up and they do whatever they can to rescue this animal. And there's a lot of goodwill among the community. Kids gather around, people in the neighborhood gather around because one of our field officers had a hawk. He had caught the hawk in the air shaft and was going to release it because there's nothing wrong with him. And you can hear it, someone had videotaped it, you can hear people clapping and our truck was there and our logo was there. So it's like we are out there doing so much more for New York City. And, you know, despite what people say about euthanasia or, you know, shelter pets, I mean, ACC is like part of the fabric of New York City because we are not just looking at animals for adoption. We're taking care of animals that either are illegal in New York City or are wildlife. This is actually, this season right now is where we see a lot more wildlife rescue. In the top right, that was an injured bird that we found in Midtown. Underneath that is a seal that was found on Staten Island. We stay with these animals until the right organization shows up. So the Department of Environmental Conservation, sometimes it's NYPD, but we're there. We're there for the community, and we're there to make a difference and to help people. And the other part of field that the community, that we're really trying to push so the community understands who we are, is just community outreach. We're responding to calls all the time, and it could be something about cruelty where we will show up to assist NYPD. We work with the ASPCA on cruelty cases. We show up when people say, I see this dog, he's chained to your fence, I think it's cruelty. I mean, we're going to go out and just find out what's going on. Maybe there's an owner. Maybe it's somebody who needs counseling about where to find food at a reasonable price. And so our field officers are really becoming community educators. So just a quick snapshot of 2015. The board, I know, voted on our budget for 2015, but it's important to note that for fiscal year 14, we ended our year on budget. And moving into 2015, we will receive an additional $552,000 to our contract through the Department of Health and the City of New York. So our contract amount will be $12.786. And like I said, that's a tremendous amount of money, and we are grateful for it. And that is 85, 87% of our budget. That's how we are able to do what we do. But it's also, how do we do better? We raise money. We raise money to do additional enrichment, better adoptions, more promotion, and we have to do better. And so last year our development was a little bit better than the year before. It was close to $1 million. We want to see that grow. We are preparing a very aggressive schedule, more events, more outreach to members of the public to help us work on getting our brand out there and help us raise money, get our name out there in the community. Some of the plans and operations, intakes in Manhattan are going to be open 24/7. That's the only thing that will be 24/7. It's not open for adoptions or anything like that. This is just intake. We are building an admissions department, I mentioned earlier, because of the growth in the number of animals coming in and owner surrenders. We really want to counsel people to find out more information so that we can place animals that are being surrendered more quickly with better information on their backgrounds and their temperaments. And if this department is successful, the collateral effect might be that we see more surrenders. ACC may become a place where people feel comfortable saying, I can't take care of my pet anymore. And if that's an alternative to opening up your door and letting them out, well then that's a good service that will be provided. We also, there was a press release that went out about a month ago from the ASPCA. They are creating a kitten nursery. That partnership is intended to help ACC with the kitten population. We're hoping that the end of July, we will see it start. The ASPCA and has been very generous in terms of working with our staff that we've designated for this kitten nursery. We will intake the kittens, we will transport them to the ASPCA, and they will manage them. Kittens need round-the-clock care. It's hard to find fosters or volunteers who want to bottle feed kittens every 2 hours, and so the ASPCA has invested a lot of money to get this nursery off the ground. And then we're also looking at other animal welfare organizations that want to partner with us, and whether they are they promote quote-unquote no-kill or not, that's okay. We don't consider ourselves killers. We consider ourselves a unique organization with a huge challenge on our hands, and to the extent that there are other organizations out there who can help us find placement or care for animals that we have, that's a win-win. Again, communications and development, we are going to build the brand. That is what we are going to spend a lot of time working on this year. And of course, as we build the brand, we hope to raise more public awareness and community support. And I mentioned the whole no-kill thing. And there is a conversation out there about New York City becoming no-kill in 2015. And that's not going to happen if the community cannot support ACC. That's a tremendous goal. And it depends on how you define it. So if you define it by live release rate, if we could get to 90%, that would be great. But it's an effort among all the animal welfare communities, and we're looking and reaching out for support so that we too can save more lives. That's what we want to do. Everybody says they want to save more lives, so does ACC, and we're committed to that. And to grow, to do these additional operations and things that we have planned for fiscal 15, we need to hire a few more positions. Right now, we have 22 either new positions or vacancies we have to fill. As I said, we've had some turnover. It's not a hurdle, it's just a fact of life. And so our HR associate has been doing a really bang-up job bringing people in and getting them to interview with our managers and supervisors. And so I'm confident that moving into fiscal 15 we'll be close to reaching our target for personnel. Okay, I'm going to turn it over to Dr. Levin for her medical report. And these are just some happy tales, people who have sent in great success stories of their adoptions. And you can see people love their pets. They dress them up, they give them their beds, it's just, there's just too many to count. We would love to promote all the happy tales.
bit more abbreviated because I'm in my 6th month here. Nonetheless, there are a number of good things that I'd like to share with you. Right after I was hired, and I was greeted by my colleagues at headquarters in the shelter, I responded that I felt welcome. And I said that not only because of the warm reception, but because they were so open about who they were, what the roles they played, where they saw ACC at that present time, and how they saw advancing animal welfare at ACC in a good direction from that point on. Of course, we felt that they had some of my ideas too, so like a plus in that column. My role as the medical director, medical director really merges the job descriptions of an administrator and a shelter veterinarian, and that is a very lovely combination that puts me in each of the shelters every week for several hours, and there really is no substitute for that to allow me to continue problem solving and developing good solutions because of those visits to the shelter. Riffing on an old book title, it really does take shelter. And the operations in the medical departments work cooperatively to ensure the best outcomes for animal comfort and health while they are in the shelter. We have both raised the bar for the standards of cleanliness and the identification of infectious agents in the shelter. For instance, there are observations and symptoms logs outside each animal room. And these are the animal care officers, the individuals who provide the daily animal husbandry for the animals. They make notations in there about abnormalities that they see, perhaps physical health or mental health. And these serve as alerts for the medical staff when they round to say something's wrong, and we see the problems that are identified by the ACOs. And this is so important for establishing that rapid time to diagnosis, and that is so important in disease prevention and disease reduction. Another area of importance is going to be the speed with which the veterinary medical staff see and first evaluate these animals. That initial evaluation, physical exam, vaccinations, the deworming, the flea and tick prevention, or any other necessary treatment that the animal is going to need. So we combine all of these efforts to reduce the number of euthanasia that we see in the shelter. If the operations department is going to be expected to have some auxiliary medical function, then it's necessary to provide them with some level of medical knowledge. And we accomplish that through my delivery of a lecture series to the non-medical staff, which not only introduces them to basic medical concepts, but also the challenges that we see to shelter animal health at ACC. The first one says it all, recognizing illness, injury, pain, and suffering in companion animals. But what does that really mean? It introduces the non-medical staff to what we might call cardinal signs of a particular disease or a group of diseases. So it's not so funny to see the little dog keep doing this with his nose. It really might be something else, or shaking the head, or holding that one day. It's not a cute posture. There might be something wrong. Again, that rapid establishment where we are going with time to diagnosis. Common shelter infectious diseases and how vaccines work. We must assume in New York City, and we are the largest animal sheltering system in the Northeast, for those that don't know that in the audience, we must assume that every animal coming in, with or without a prior guardian, and most of them don't, are coming in incubating some infectious disease. So it's important, again, that we see them and evaluate them on a timely basis. And we have to know how to combat these diseases. And we have to know, they need to know how vaccines work. No vaccine is 100% effective, but they are pretty darn effective. And we cover why vaccines work, why vaccines fail, why animals get sick in the shelter, what we do to make them feel better in the shelter, why we succeed, why we don't. And these are complex issues, but it's distilled to a lay level, and they become a very important arm of the medical department. And the last lecture that I have in the series right now is called The Fix, the Anatomy of Spay and Neuter Surgeries in Dogs and Cats. We want the staff to have an understanding what really goes on with spay and neuter surgery, because we may have somebody come back at some point or make a phone call and say, I'm concerned. My dog looks like this, my cat looks like this, they're doing that. So they can understand what possible complications can happen, what we do to avoid those. But everybody needs to be very well-grounded in these basic medical concepts. We're very lucky to have additional training modules which are sponsored and presented by Merck at no cost to us, and others that are conducted by our operations section. And this rounds out a format which allows us to develop that level of outstanding care throughout the shelters. Something important, a much sadder topic, is for our licensed veterinary technicians and certified euthanasia technician, or the lecture in humane and scientific concepts in animal euthanasia. And I emphasize humane as the first part of that title because it's not only important to ACC for how we approach end of life and the animals entrusted to our care, but it truly is thematic for everything that we do in the shelter setting.
Just wondering, is there, for an animal that's incubating disease that you talked about earlier, is there anything about the shelter environment that would cause the disease to express itself?
We work, 2 of the 3 shelters are antique, and they were designed in a time where animals came to stay out, pushed straight away, and then be euthanized. We're in a new environment for 2 decades, and we want to preserve that life. So we have to look at improved airflow systems, improved traffic flow systems. The 3rd full-service shelter in Brooklyn has been converted from a former factory. It was not designed for that purpose. So there are facility challenges that we struggle with. And I have to tell you, truly, for everything that we're challenged with, I think ACC is doing a pretty good job. And that's from a veterinarian's perspective, and in terms of looking at population health as well as individual animals health. Does that answer your question?
So it's the shelter facilities themselves that would cause the incubating disease to come after?
Well, no. Let's look at it. It doesn't help if we don't have a better airflow system or better traffic patterns, because those things are put upon us by the existing shelter design. That's not going to change without some other sort of activity. But I drink way too much tea, and so I look at teapots a lot, and I'm watching like the steam is going to come out. And incubating infectious disease is like the same thing. So this dog or cat walks in the door on day 1, probably incubating a disease that they've been breathing just like the rest of us, and they come into the shelter environment, and that it's like that teapot. We don't see that steam coming out yet. We don't see that disease emanating from that boiler of the teapot. But it's boiling in there, and going with a typical incubation period, we'll see it. We try very hard. The animals come in. We do believe that they're seen pretty rapidly. They get that evaluation. If they're obviously sick when they come in, they get moved to isolation and they receive the proper medical treatment. If they're not obviously sick, they're receiving their vaccinations, their dewormings, the other preventive medical measures that we need to do. But vaccines take the time to do what's called load. It's not a magic wand. It's not this, I'm sorry, fallacious concept that can be promoted by, some boarding kennels or some other rumors, some that I can't see your dog or cat today unless they receive their rabies vaccine. And so we might have a person typically go, I'm going to schlep to the vet really quick, get that rabies vaccine, or for the dogs that board a telekennel cough vaccine, and I'm going to drive right from there 15 minutes, an hour later, down the road to the groomer, or we're going on vacation for a week, and they're at the kennel. That vaccine is just starting to load. I am delighted that the quickest vaccine that we have working in the shelter right now is a new, superior offering of the intranasal. It gets dripped in, not on a needle, dripped in the nose, kennel cough vaccine. That works in 2 days versus 3 weeks for the injectable type. But you know what? 2 days is still 2 days. As rapid as that is, it's still 2 days. And we are the largest animal sheltering system in the Northeast, and we have this big pool incubating in that teapot, and we are fighting against the wall, and we're trying to overcome that huge inoculum of contagion from those animals being present in the shelter. It's not going to be a perfect science, so we're fighting an uphill battle, but you can't give up. So we try, and we have to do the right things.
Look at the young time. The stress is changing the environment wherever the cat or dog came from to a different environment. Stress brings on things that people or other animals. So stress is a major factor.
Because the perception is that animals come in healthy, contract diseases from in the shelter, but what you're saying is many of the animals come in incubating diseases already. So it could be triggers or it could be natural.
Right.
Disease.
Exactly, and Dr. Coleman is spot on with that. Stress is so important. I think my colleagues at Merck will even say the most important thing in a shelter that's going to cause disease is stress. Well, we work pretty hard to reduce that. It's not only the MP3 music, which is very soothing, and I like it. I tend to try to hang out by a door while I'm writing notes and talking on the phone. But having physical examinations, for example, that reduce the anxiety. The human is not these animals' first languages, and they do understand kindness, though, and they do understand treats. And I have wonderful colleagues in behavior and enrichment who work with us to ensure that that's what's going to happen. And then going into an environment, say we have a stray dog from the street. Even though he is safer in that big run or the larger cage than that overpass he was living under, it's different. It's different here. I know where my next meal's coming from because they've been doing it the past day or so, but it's not familiar to me. And now I'm getting scared. And there are people in here, and there are other animals in here, and I don't know if they like me or not. So there are all sorts of enrichment protocols and behavior protocols and medical protocols, and again, thematic, humane, kindness protocols that are so important. So I agree with Dr. Coleman. Stress is a big one to just get things out of control. Think of how many people break down just from stress. Well, what am I doing in the shelter? Probably channeling a little bit of Ed Koch. I'll walk through and I'll say, hey, how are we doing? And I'll start usually with the operations folks, because there's some place I have to bring all of my material, and it's usually one of their offices. And how are we doing? Anything I need to know about? Anything in the facility that I need to know about as a veterinarian? The operations director, Melissa Weber, does an outstanding job with managing the facilities. This is just my nosiness on the medical level at that moment in time, giving a snapshot of what I need to know today or for the week, and I need to speak with my colleague about that. Then I meet with the veterinarians. What did we do right this week? Morbidity, sickness, and mortality, death, conferences. What did we do right this week? What could we have done better? And what did we do wrong? And we learn from this. We review new protocols, we share new knowledge. Again, I say we capitalize on the intellectual strengths and the clinical veterinary skills of our medical staff. And that's nice because I get to see that around, and Dr. here at Brooklyn could have an important concept for this doctor in Manhattan or this doctor in Staten Island, and we're all on the phones with each other. And I know we're all going to see, through me, each other each week, and that's just a very important weekly meeting with medical supervisors and quality assurance, quality control, licensed veterinary technician. We talk about how we're going to move progress in the shelter. What are we going to do about improving animal health? We don't want to talk about an at-risk list. We don't want to talk about unnecessary euthanasia. How are we going to avoid this? How are we going to get greater health in the shelters? And I have to say that the addition of our new licensed veterinary tech called a QA/QC, or Quality Assurance Quality Control Tech. She has multiple functions and really has strengthened the medical department and the veterinary technical core. A few ways that she does that, and I'll give you 5 of them, and the first 4 really have to do specifically with disease prevention and reduction. She looks at the performance in each of the shelters of the veterinary technicians. She is someone who comes not only with a wealth and a depth of clinical experience, but has also been a teacher in a veterinary technical program. So she's really on the cutting edge, and she brings that here to our technicians. So she tweaks what they're doing. She suggests better methods. She is teaching them. That raises their performance. Infection control management, even within a medical department at each of the facilities, what can we do better in here to maintain cleanliness? What can we do better in here about traffic flow patterns? What do we need to know about taking care of machinery that itself may be an infectious agent? Inventory management. As one of my colleagues who is an animal law says, time is short and so are resources. And we have a budget that is definite, not infinite. And so we really have to make that dollar count. And we try to do that through, among other things, inventory management and smart buying. And she's very helpful with educating them about how to do that. The management of their continuing education. She can assess, okay, you look a little desperate in this area, or a little light in this area, you can use some help, and she'll recommend that. And lastly, on the subject of controlled substances, that's important, teaching everybody and keeping them up to date on how those should be managed as well. And of course, when I'm in the shelter, I take a walk through because I want to see how old the kids, as I call them, the fuzzy ones, are doing, and make my own assessment of how we're doing medically. As I said, my position is a merge of shelter veterinarian and administrator, and that's what I'm doing at headquarters. That's where I'm doing my cerebral exercises. And I do have regular interaction with everybody, and that's across all departments, whether it's finance or it's our information technology, who I think are challenged by me. When I was at Johns Hopkins, I had the nickname of Conan, the software destroyer. I'm not supposed to say that, but they managed me pretty well. We have our own monthly morbidity and mortality conference, and this is what I use to advise the operations and the supervisory staff in key medical issues that we have in the shelters, so that they're aware of it and there are no surprises. It gives me a daily opportunity to remind operations how important I find them and how much like this we are. We both need to work together to reduce disease and prevent it, and there is that necessary overlap that we have with operations that delivers the best outcome. Of course, I'm there, as I said before, delivering lectures, whether it's to the non-medical staff or it's to the LVTs, and I think a bit about program development. Where are we going to go in ACC Medical? We're in the process of job search for an additional number of full-time veterinarians and licensed veterinary technicians, and that does have an impact on animal health, because we need more. It's just that simple. More eyes on the animals, greater chance that we're going to be picking up disease earlier, and just workload for each veterinarian becomes more humane, and they have a better mind about handling these animals in a proper way. Public support, that would be wonderful. We have a discrete amount from the DOH. We can also use from the public. And certainly every time is an important time. We have our wish list of digital x-ray machines, electrocautery units, which help us with limiting bleeding during surgeries, and we're not talking about life-threatening hemorrhages, just things which are important for us in the surgical field, suction systems, a number of other things, and we'll probably post that on our website. It is kitten season, as Risa and Ellen have already mentioned, and they're coming from everywhere. And it would be wonderful to have more fosters to allow us to handle these little ones, because the shelter truly is not a place for these bottle babies and the neonates. They need to get out, and they can come back when they're a little bit older and they've got their vaccines loading and they're in a better place to face the challenges that the shelter presents. So it is our logo, Adopt, Foster, Volunteer, and Donate. That really says it all. I would like there to be continued communication between the medical department and the public, and I'm very grateful for the individuals who have reached out to me to speak about their concerns, because they are my barometer out there, and they let us know how we're doing from the public perspective. As I said, this is abbreviated because I'm in the 6th month here, but what I anticipate over the next 6 months of my tenure and for the next year for ANC is that our efforts are going to advance not only the life-saving of our animals, but they're going to serve as a meaningful model of sheltering, not only for New York City, but for other cities in the country.
Thanks, Dr. Lemon. Thanks, Risa, for really 2 great presentations. This slide is a really great slide too, because in a way, I think we're all impressed by the entire staff, but the leadership we're seeing at ACC, that this is a very complicated ecosystem that we're working in, the city environment, public-private, the partnerships we have, the need for public help, the need for funding, the need for capital improvements. There's so many different things, and the thing that I think I focused on before too is this wish list. I'm just thinking now that, you know, with Kickstarter or something, we should through our social media just go down the list, go and collect the funding from everybody one item at a time, and let's just get at least the wish list taken care of before we meet again the next time. I think that's a really good goal for us. There's a lot of big long-term things that we're doing, and I'm very confident that we're on the right direction. We're taking care of as we're constantly thinking about it and reminded 30,000 animals a year, and we're also looking to how we can do all of that better and how we can work better with everyone to make that happen. So with that note, we have 2 people who've signed up for public comments. Thomas Skopak, if you could start, that would be great.
Okay. Good morning, members of the board. First, I want to compliment you, Risa, on a really outstanding and informative presentation, so much so that I feel compelled to deviate from my script because many of the numbers I was going to present you actually addressed. What I want to talk about is the positive trend on the live release rate and the ACC's ability to sustain that trend. As a financial professional, I'm always concerned about the underlying drivers about a positive trend. And having looked at the ACC numbers for the past several years, there's a couple of things I want to bring up that concern me in regards to that may impact the ability to sustain that rate. First off is, I'm looking at only what has transpired with the dogs for the last couple of years, but looking at the at-risk list, there has been a 21% increase in the number of unique dogs that are placed on that list for the period of January through May 2013 to 2014. So the risk is sounding dramatic. What that means is that ACC wants to kill 260 more dogs in the period this year versus last year. Obviously, you didn't want to kill them, but I mean, again, that's what it's telling you. Now, the concern on this is exponentially greater than the increase in intakes, which is only 6%. So that's a warning sign to me about the ability to sustain the placement rate. Additionally, the direct placement numbers, right? So, Risa pointed out it's been flat year on year. That is something that has had a major investment made by ACC and the Department of Health. And that is something we should really be seeing double-digit growth in year on year so that we can get to the point of not having to publish that risk list anymore. And lastly, as Risa pointed out, there has been an uptick in the number of dogs that have been and cats that have been placed by new home partners. Again, talking earlier about Lisa's presentation about the stress in the shelters. This puts stress in the ability for in the placement process where it's essentially a game of chicken each night where people are trying to save these dogs. So again, a lot of progress has been made, but again, a little bit of a warning sign there and the ability to sustain the live release rate.
No, I would just say that I think the board would agree that we should see the adoption numbers improve given the investment. I think that's why we asked the questions about the weather earlier. I do think they will improve, and we're hoping that they're going to improve when we look at it in the entire fiscal year.
And just continue to improve as well. I mean, it really is, as we all know, just how big of an effort and focus that's been. Do you want to add anything, Marissa?
I do, and I have to say thank you. I've seen you at many events, many off-site events, and I think that that's tremendously helpful. And we're not afraid of criticism or constructive criticism, and the things that you raise are a real concern. I hope that by the end of the fiscal year, we'll see close to 900, maybe 1,000 adoptions. I think that's probably high. We're at 860 right now for the fiscal year, so we are definitely seeing an improvement. And that's 860 possibly may have been euthanized last year, so that's a plus, but I'm saying not good enough. We definitely want to place more animals. And so I do appreciate that you come to our events and that you can come up with an open mind, and that if more people follow your model, I think we would really have a recipe for greater success. We're driven by success. What does success look like? It looks like a community working together to save 30,000 animals. So I appreciate your comments. I know you've emailed our staff before. We take that very seriously. I was looking at our behavior supervisor's assessment of one of the recent emails that you sent about SAFER. We study it. We're interested in making improvements, so thank you for your comments.
Thank you. Jay Brown.
Thank you. There have been a lot of improvements, and I thank you all for that. I see that you're talking a lot about stress in the shelters, and I agree that's definitely concern behavior as far as both animals contracting diseases and being able to be adoptable or not. My question is, it's from my knowledge through level 2 volunteers that many of the dogs are only walked once a day and are otherwise forced to eliminate in the cage or hold it in. Dogs not getting proper amount of walks is a very big part of what would stress them out. I'm suggesting and hoping that you can commit to walking dogs at least twice a day. Even the dogs that are not in the easily adoptable area where I know most volunteers prefer to walk dogs, but I'm asking if you can commit to walking dogs twice a day, which will really take a lot of the stress off them. You can only imagine how stressful it can be to have to hold it in for 24 hours. And I think that will eliminate a lot of behavioral issues and a lot of stress. Additionally, I'm going to go out on a limb. I know it's not a very sexy topic anymore, but if you are still giving $20,000 a month to a financial consulting firm, I think your wish list is more important than that. Forgive the pun, but if we're chasing our tails, spending money to figure out how to spend money, I think that's not a good use of funding. I would love to see the shelter, the antiquated shelters get improved with that money. I know there's a $200,000 answering machine that you guys want to get, which I think is a great idea. That way the dog doesn't have to be bounced around if they suspect there's a broken limb or something like that. It's within the facility. That could be used to the dog or cat would get immediate care and immediate attention instead of having to be sent somewhere else. So those are the two issues that I really want to bring up today. Thank you very much.
Yeah, just jumping on the last issue first, because I know it's been raised here a couple times, but the thing that you need to understand about the money that we're spending for our, essentially our entire financial department to be outsourced allows us not to have the costs of an entire department, which would just increase our operating costs.
But there are,
So, from my understanding, having an in-house financial group would actually far exceed that amount of money, because you're talking not only about accountants, accounts payable, you're talking about probably a chief financial officer for an organization this size, all the fiscal reporting that has to be done to the federal government, to put together the 990, which is a requirement of all not-for-profit organizations. So actually, it's kind of a bargain, to be honest with you. That doesn't deny that there are many other things that we would want to spend money on, and I do think that I appreciate the point about let's figure out how to get that wish list taken care of one by one, whether it's through figuring out, corporate solicitations or grants or private donations. But I think there may be a misunderstanding just about the requirements for an organization of this fiscal size and what it takes to keep the accounts straight and everyone paid on time and our bills paid. So I appreciate your point, but I think it's a necessary expenditure and probably cheaper than what we would get if we had it in-house.
I mean, I think that's something you should definitely investigate. $20,000 for a consultation to the kind of money corporations. I'm a small business fan myself. In Brooklyn, New York. I don't run an organization of your size, but the $20,000 that someone pointed out to me is like Apple money.
We're a $15 million multi-site, 250 staff here. So it's.
I appreciate
not-
that, couldn't find one person to
It's
take
not a
care of this.
consultant.
Can I just clarify that?
We've explained it and we can talk more.
Okay, fair enough.
Yeah, I just want to clarify, the terms you're using are just not appropriate. It's not a consultative service, this is a.
That's the term I got from you guys.
I know, but you're characterizing it correctly. It's not a $20,000 conversation we have about direction and priority. It's a set of very discrete and frankly expensive services that are required for accounts receivable, payable, for accounting services, for payroll, for many other activities. And it's not, so I just don't want you to sort of think about it as like, we're just asking somebody to give us some advice. This is a service for them.
I would like to see it investigated as something that we've done in the past.
I'm telling you, we have, and it would be more expensive.
We would be thrilled to have enough staff and enough volunteers at level 2 to come in and walk dogs as frequently as possible. Right now, every dog is getting walked at least one time a day. Will animals urinate or defecate in their cages? Yes, that's a reality. But we are trying as best we can to address that. And yes, I would love to see that happen. It's a staffing challenge, it's a resource challenge, but we are really committed in our enrichment program to make that happen. Do you want to add some? We agree with you. Getting a dog out is great. And if we have 561 animals, so let's say 250 dogs that need a walk twice a day, that's a lot of use of resources, of time, of personnel. That would be that's a great way to focus. And we agree, it's a great idea. Right now, I feel that we've done tremendous improvement in terms of getting our dogs out, and certainly the ones in isolation, where there was a lot of criticism about animals in isolation not getting their fair amount of enrichment. And so to be able to get them outside and have our behavior enrichment team work with them is a real plus. So we are moving in that direction.
Okay, well, thank you. I should mention too, there was one question submitted to us about asking us to hold one of these board meetings in an evening time slot, and we'll definitely look into that. There are challenges to doing it here. We're very kindly hosted by the Department of Health. But I think more importantly, I think the point of that question is about making sure that we're out and speaking to everyone like we are today. And there are people who can't take time off from work who really are passionate and concerned and working hard on our behalf or interested in the work we're doing and wanting to talk to us. So we're definitely, we hear that, and we will figure out a way to get out in the evening sometime. Yeah, you can always submit questions in advance. Clearly, one person knew that, and we posted on our website, and in addition, we've been videotaped today as well, and that video will be on the Department of Health website, so in compliance with the public meetings law. So thank you all for coming. Thank you, board members. Thank you, ACC staff, and Marisa, your team. Thanks so much. Bye.